One of the most common things I get asked about, and there's a lot of concern, is regarding low-dose topical vaginal estrogen if you're estrogen positive receptive breast cancer. Hi, I'm Dr. Nagat, an NHS GP with a specialist interest in women's health, and I'm so excited to introduce you to my dear friend Susie.
Hi, I'm Dr. Susie Unsworth, so I'm a menopause doctor and I specialise in looking after women who've had breast cancer.
So, Susie, if you've got a patient who's got, say, vaginal symptoms like atrophy, irritation, itching, painful sex, recurrent urinary tract infection, so genitourinary syndrome of the menopause, what type of low-dose topical vaginal estrogens are safe? Are they safe?
Okay, yeah, so this is often quite a controversial sort of question, but actually the answer is it's fairly straightforward for most women. So anyone who's had a history of breast cancer, who's completed their treatment, they can absolutely use vaginal estrogen. So we would most commonly suggest using estriol preparations. So these are what we call ultra low dose. So there's certain brands that are particularly good for that, but actually any of those could be used. Sometimes women may use some slightly different preparations that have estradiol in them, but they're still fine to use as well. And so for anyone with any history of breast cancer, that's absolutely fine. The other situation is maybe where they're on medication, so where they're actually on other treatments for their breast cancer. And so some of the treatments that we use do have an effect on hormones, and there's a particular treatment we use called tamoxifen. And again, in this group of women, it's absolutely fine for us to use vaginal estrogen. So they would make up, a significant number of women that I see. However, there is another group of women that are using a medication called an aromatase inhibitor, and this is where the slight anxiety arises. And it's mainly because of the way aromatase inhibitors work, by actually totally depleting your body of estrogen. The suggestion is, if we give you a little bit back, is that going to counteract that effect? Most of the data doesn't say that it does. There's a little bit of data to suggest that it might slightly increase the risk of recurrence, but actually most of the data is really reassuring. So for most women, I still am really quite happy for them to use it. But if you're on an aromatase inhibitor, it's probably worth having a bit more of a discussion with your professional who's looking after you to decide if it is the right choice for you.
So if you've got tamoxifen, so you're not being on aromatase inhibitors, but things like Vagifem, Vagirux, E-string, how long can you use them for? Would you say forevermore?
Yeah, I mean, I would say once you've made that decision that we can use it, you can use it like any other woman. And actually, I would say for most women, you probably want to be using them forever, because the symptom is just going to come back as soon as you stop using it. So although they're not licensed to be used indefinitely, practically a lot of colleagues, and myself included, will continue to use these in women pretty much lifelong.
So you've heard it from two experts. Please speak to your doctor. Topical vaginal estrogen is safe if you've had a history of breast cancer. If you're on aromatase inhibitors, you need to have that really careful conversations because it's slightly nuanced, but I hope that's been useful. Happy to take any questions.